So the differential diagnosis, that is disorders of iron metabolism, either iron is not properly metabolized in the body, whether it is consumed less or it is not being absorbed, or due to other factors that is present in the iron metabolism. Coming to disorders of heme synthesis, iron is subsequently taken, but heme is not getting processed. Hemoglobin is a protein combined of iron as well as globin chain. So iron heme synthesis is affected, it will lead to sideroblastic anemia. And if the globin disorders is there, so there can be two parts, right? Either iron can be absent or metabolism is defect, or heme synthesis itself is affected, means sideroblastic anemia, or globin, the protein component is affected, that is called as thalassemia or thalassemic syndromes. So this is the fourth thing. First part, where the iron is being not absorbed either because of inflammation or not available for heme formation, is called as IDA, that is iron deficiency anemia, or anemia of inflammation, that chronic inflammation. Will deal about that. Then come to protoporphyrin to heme, that is heme synthesis is affected, that will lead to sideroblastic anemia. Then comes globin chain, protein component of the cell, the hemoglobin, that is affected, will lead to thalassemia. Eventually everything will lead to reduction in hemoglobin, quantitatively or qualitatively, that will lead to hemoglobin concentration is reduced, will lead to anemia, predominant particularly microcytic hypochromic anemia. Coming to IDA, as far as you know, point any random person in a street or a woman in your family or anyone in sick, you will find 90% of them may be anemic, particularly of this condition, iron deficiency anemia. Either we are not consuming proper iron rich foods, or we are having some dietary problems or some other condition associated with failure in absorption of iron in the blood systems. Okay, and most common type of anemia in 2 to 5 year old is this. So if you are having any person aged less than 5 year old in your family, chances of them being anemic is more than 50%. Okay, coming to IDA proper. IDA is the most common cause of anemia worldwide. 50% of preschool children and pregnant women in developing countries, including our country, is having anemia or on the verge of getting anemia. Diagnosis is easy, but you should always look for the cause. You can say by looking itself IDA can be there and all these things, but looking and saying IDA is not the condition. Okay, we have to look for a cause, identify the condition that leads to the anemia, and we have to treat effectively not only the IDA as well as the cause for the disease, so that anemia doesn't come back and bite the patient again.